right, so welcome to another exciting and riveting experience on Ghana's Youth President. For those of you who are first-time watchers here on Ghana's Youth President, is a reality TV show that prepares the platform for young and brilliant, smart people who are ready to take public office. Of course, they have the drive and passion, and so they are here to show you, week in, week out, they will be here to lock horns on the battlefield of ideas in front of the judges and, of course, our speaker. Well, 1 point is all they need to put together 10 points in each episode. One thing that's for sure is that 1 point equals 20 Ghana cedis. After all, we would adjudge the best performing cabinet. They walk home with 20,000 Ghana cedis cash for a project fund. Then, also, of course, we also have the presidential candidate that emerges as the first ever Ghana's Youth President, walking home with 11,000 Ghana cedis, which he shares with his ministers. That's so good. And of course, what's more is that we have consolation prizes for all our best performing ministers here on the show. And so this is where we are. But of course, as we said in our previous episodes, you are also part of the show. And so you get to vote. You have 40% vote. And of course, on the scorecard of our judges, they have 60%. And so for you at home watching us and everybody that wants to be part, all you have to do is to dial *714 *13 hash. I'll take it again, *714 *13 hash. And then you follow the prompt. Of course, you have the names of the nominees over there and your favorite cabinet. Just select the bundle for voting, and then you're good to go. Follow the prompt, and let's have you get in the 40%. Well, so today we're talking about health. We're going to be having our candidates lock horns on issues of health. And of course, as Mahatma Gandhi said, it is health that is real wealth, not the silver and gold and pieces of it. Well, we are talking about health issues here. We're going to be having our health ministers from the various cabinets lock horns here on the battlefield of ideas. I will take a break here. When we come back, I'll get to introduce our speaker and, of course, our judges. Don't go anywhere. Ghana's Youth President returns shortly. Well, so as Alexander Graham Bell says, before anything else, preparation is the key to success. We are prepared and we are ready to start. But of course, I just want to remind all of you that voting begins now. And so if you're at home, just pick your phone, dial *714 *13 hash and follow the prompt and then get to vote for your best nominee and cabinet. Of course, I'll get now to the judges and ask of what they think of today and what they expect. Their job is simple, is to score and assess our candidates. Thank you very much, ladies and gentlemen. I'll start off with you, lawyer Elsie Apa, who is also a human resource specialist. Now, what are your expectations? We are dealing with health issues today.
Absolutely. As we know, in Ghana today, available statistics reveals that in every 100,000 deaths, about 640 women or children die through the process, which makes our mortality rates, maternal mortality rates, quite high. And from the brilliant health ministers and as a policy analyst, I want great ideas as to how Ghana can tackle this issue. And we know the role nursing education plays in this process. Financing these and how sustainable our processes have been in the past is an issue. So from the youngsters, I'm expecting real solutions to the nation's problem.
Thank you very much. All right, so we'll now move on to Mr. Jignesh Viradia. He's a businessman. Of course, I am also interested in, because health is tied to our socioeconomic life here and whatever it is that we do. What do you expect today on health issues?
From all the cabinets, and all the ministers who are going to showcase their policies and their ideas in terms of value adding to the health issues pertaining to Ghana. I want to see the fire. The fire should be in the battlefield between showcasing and throwing the right point, which will bring a difference to the nation.
All right, thank you to Mr. Jignesh Viradia for joining us. And of course, our guest judge for today, Mr. Ivor Greenstreet Kobina. He is a former presidential candidate of CPP and of course a lawyer as well. Thank you very much for joining us as well. Are you any different in terms of views from what the judges have said?
Well, we never like to hear that doctors are on strike or that nurses are on strike. We all know we can all get unwell ourselves, so everybody wants the best health care for all the citizens of Ghana. Let's wait and see what the policies are on offer today.
Let's wait and see. A round of applause for all our judges. So they have 60% on their scorecard and you have 40% at home. So remember, the code to dial is *714 *13# to keep voting for your best nominee, of course, your candidate and cabinet. I'll take a breather here. When I come back, I'll introduce our contestants. All right, so welcome back from that quick break. And remember, you're still live here on Ghana's Youth President, the only reality TV show that makes you see the youngsters lock on the battlefield of ideas. Well, as I said before, you have 40% as well. So keep voting. Remember, the code is *714 *13#. All right, so I get to introduce to you who the cabinets are and how many of them are. We have 6 cabinets. First off, let's welcome Yaa Asantewaa cabinet. We also have the Democrats cabinet competing. The Republic cabinet is also represented here. Let's put our hands together for Osachifo cabinet as well. The Gold Coast cabinet is also represented. Well, so we start off quickly with our first representatives. We'll start off with Yaa Asantewaa and Democrats. And so on my left, representing the Health Ministry of Yaa Asantewaa cabinet, is Chamberlain Selali Atigbe. And just close to me on my right here, beautifully dressed in a smock, from the Democrats cabinet is Isaac Boateng Dramina. Gentlemen, are you ready? Judges, Mr. Speaker, we have 3 minutes, and we'll start off with you. 3 minutes to tell us what you make of health issues as far as your ministry is concerned. And so 3 minutes, your time starts now.
Once again, it's such a privilege to be here to address my Honorable Right Speaker once again. Right Honorable Speaker, judges, Your Excellencies, distinguished members of the Cabinet, colleagues, ministers, ladies and gentlemen. Before I continue, I want us to know that we are what we eat. We are the outcome of what we input into our system. And here today we're coming to talk about systems of health. Now, as critical as we know, this sector is very critical to the economy. The health ministry seeks to improve the health status of all people living in Ghana, thereby contributing to government's vision for a universal health coverage and a healthy population. Knowing this, my team and myself, having been in office for some time now, are much aware of the challenges we face, especially with the high rate of mortality, infant and maternal mortality rates, the inaccessible of roads to our health facilities, the lack of political will to make the health insurance scheme work. And what I mean by work is to have a proper scheme that is devoid of partisan politics. Going forward, my speech today, or my address to the House today, is focused on two integral pivots: the MME frameworks of the ministry and the introduction of a new policy, which I think will go a long way to help in addressing these challenges. That is the plant-based medicine that we seek to integrate into the mainstream medicine. Now, going forward, I think that the health insurance scheme and its body should be given and strengthened. What do I mean by strengthened? Now, the body is a scheme and its governing body is a council. It is my desire to appeal. I'm currently in talks with the cabinet to have an act so that this body can become an authority. When it becomes an authority, it will have full control of its resources.
All right, thank you very much. A round of applause, please. The Democrats cabinet rep and Isaac Boateng Jamina. Judges, in 3 minutes, let's hear you.
Right, Honorable Speaker, when voted into power, we are going to revamp the national health insurance to a health for all insurance, which is a mandatory national insurance. This will be funded by 2.5% of value-added tax and automatic half-yearly deductions from mobile money, wallets, and bank accounts based on social statuses. Beneficiaries will be given an ATM card, which will be used to make payments at points of service or points of health delivery. We are going to establish a paperless system called the Integrated Medical Records. This will sync all health facilities right from the CHIPS compound to the referral centers. Users will be given an identification number, which will enable health professionals easy access to patient health records from other units. The Apomodin Social Health app will be developed that will serve as a health promotion tool to enable users navigate the health system by giving them access to health professionals and services. The Ambu Cycle Emergency Services will be instituted to deliver first aid management at points of call before arrival of ambulances. This will help improve survival rates of emergency cases. And 3% of the national budget will be dedicated to our Apomodin Fund. This will be used to support programs like the National Malaria Control Program and promote research into alternative medicine. With this research, production of herbal medications can be standardized to facilitate appropriate use and possible exportation. And these drugs will be included in the standard treatment guidelines. The CHIPS program will be upscaled to enable coverage in rural areas lacking basic health care services. Concerning maternal mortality ratio, the current ratio 2017 Ghana Maternal Health Survey is 310 maternal deaths per 100,000 live births. And these are due to reasons summarized into what we call the 3 delays. So in the 3 delays, these mothers have problems recognizing illness and the need for health care and taking decision to seek health care. They also have problem getting to the health facility due to lack of means of transportation, poor road system, and delay. The last point is delay in receiving health care on arrival at the facility. So I'm starting with delay in receiving health care on arrival at the facility. We are looking at high priority activities. First, we are looking at training doctors. We are looking at training doctors in obstetric surgery. We are looking at training community health nurses to insert implants as pertain to family planning. We are looking at training staff on the use of CTG machines during monitoring of deliveries. One of the commonest and the topmost cause of death in mothers is hemorrhage. And this is due to either hemorrhage before delivery or hemorrhage after delivery. So the institution of this blood donation day will provide blood enough to cater for these mothers.
All
and
right,
we also like
a round of applause,
procurement.
please. It looks like someone came prepared, indeed. But of course, that's what he has to say. I don't know what the judges have to say. And so I'll start off with the first judge, Mr. Jignesh Viradia. Well, we'll start with Mr. Chamberlain Salali Ajigbe. What do you think of what he's presented?
Mr. Health Minister, thank you for your brief presentation. What
Thank
I could
you.
not found in your entire policy is what you are addressing to. Are you addressing to a policy which is backed by the healthcare and the disease or the problems that the nation faces? Because there was no clarity in terms of which area are you addressing. Are you addressing mortality? Are you addressing malaria? Are you addressing what?
I am addressing the strengthening of MME and also the integration of traditional medicine. I say MME because I believe that the ministry has a lot of policies already in place. Projects are up running, but what is lacking is the proper monitoring and evaluation that will provide real-time information, real-time feedback to enable actions to be implemented to improve on what is already on the ground.
So what are the percentage of diseases in the nation which you want to address?
So the percentage of diseases, if you should look at the health sector annual report, the top 10 diseases that are causing mortality and death are lifestyle-related diseases.
You can name top 2.
Yes, we have hypertension. We also have diabetes. And these conditions are lifestyle-related. And if we are able to change and promote that homes and households should inculcate in their daily lifestyle the need for nutrition, then we can reduce this alarming rate and not burden the already existing facilities, which is not able to withhold the pressure that is coming to these systems.
All right, so can we hear from any other judge if you're ready?
Okay, Mr. Jigbe, right? Ajigbe. Okay. You are beautifully dressed.
Thank you.
I think that's a great start. I'm impressed by the presentation you made. You had a shaky voice at a point. Wasn't sure whether you were becoming emotional or you were tensed. The issue or your suggestion on the alternative medicine for the health sector I find quite interesting.
Yes.
But the how seems to be missing from your presentation. And knowing also the challenge that traditional medicine in Ghana has not been well researched and documented, I thought your presentation or the alternative policy solution will also have something to touch on research and the right way of prescribing these forms of medication to
Yes.
people. And my last question to you is, how do you envisage making financing of health education sustainable?
Okay, thank you. I'll start with the second question. It is indeed outlined here, but unfortunately, I couldn't have the opportunity to outline them.
You knew you had 3 minutes.
Yes. So now, research is because these traditional practitioners are not being put under an organized umbrella which does not institute knowledge sharing. Though they have research in their individual fields, when put together, will bring a holistic view where these individual knowledges can be collated and documented for it to become an institutional resource for further improvement. Now, with the third question, making health education accessible. It is our vision that education is key to the development of every initiative. Now, we have a backlog of students that have graduated but have not been able to be absorbed into these institutions.
All right, thank you very much. Ivor, I don't know, you were full of smiles at some point. Do you have anything interesting?
Only that I'll be recommending to the presidents of the YA Asante cabinet that they should reshuffle their health minister.
Anyway, thank you very much. A round of applause, please. That's a very serious advice, though, but let's wait and see how it pans out. Well, we'll start off quickly again now with the presentation of Mr. Isaac Boateng Jamina from Democrats Cabinet. I think I want to start off with Mr. Ivor Greenstreet on this one.
Yes, a good presentation, lots of information. You spoke very, very quickly, which made it difficult sometimes to pick all the points you were making. One thing that, should I say, alarmed me, I think you referred to some 2.5% additional tax on VAT that we would have to pay to carry out some of these programs you had. I feel as though, the Ghanaians are overtaxed and overburdened already with so many taxes. Would you or recommend to your cabinet to consider taxing these large multinational gold companies or taking more from these oil companies and maybe getting them the funds from that area? They seem to be able to take our gold and oil out of the country without us really seeming to benefit. And I think VAT will cause more hardship for the ordinary Ghanaian. Have you considered other alternatives of funding your very important and very good programs that you outlined?
Thank you very much. So our primary source of funding for this Health for All insurance is automatic half-yearly deductions from mobile money wallets and bank accounts based on social status, as I mentioned earlier. The second is we are going to maintain strong partnership between corporate sector and then district regional hospitals, so that as a matter of corporate social responsibility, these companies are going to help in terms of sponsoring health programs and then providing health services. And we're also looking at funding from our international stakeholders like DANIDA, like the World Bank, the United Nations Program Fund, among others.
All right, so we'll go for a follow-up. I saw same smiles as Mr. Ivor. Are you also considering a reshuffle?
Ghana Beyond Aid. So I'm wondering what we are doing with Danida, the Danes, and all of that. But anyway, I think when we say Ghana Beyond Aid, and we are thinking about how to come out of some of these things, I don't think we should be depending or relying largely on other countries' surplus funds to take care of our basic needs. So that's just a point to you. I want to find out from you, what was your source of data for the reference you made to the maternal mortality ratios?
So the maternal mortality ratio is 2017 Ghana Maternal Health Survey. There's 310 maternal deaths per 100,000 live births.
Thank you very much. That's right. And then I want to find out from you, it's also the same question I asked the previous cabinet or the health minister. How do you envisage financing health education, particularly nursing education in Ghana, in a sustainable way?
Thank you very much. So we are looking at how to help or promote health delivery by health professionals in our countries. So one of the things that we are going to do is that we are going to subsidize school fees paid by these people in these institutions. And secondly, concerning the nursing allowance, unfortunately, we are going to scrap off the nursing allowance so that we would have, nurses are given 400 Ghana cedis each month, which amounts to a total of about 1,200 Ghana cedis per semester. And this monies can be used to pay nurses when they complete school. So we are going to cut off the allowance and bits. And then for health education, our Apomodin Social Health app has a component whereby day in and day out there is a health education program ongoing online that anyone can have access to. And community health nurses go on outreach services. And with these outreach services, they can promote health education by providing health information to the people.
I like
the
creativity in
that's
your team's work. Keep it up.
All right. So we'll go to Mr. Jignesh Viradia. Well, healthcare, is there anything?
Well, I looked upon one of your very impressive point in terms of generating an ID to do a digital payment system, but I would like you to advise and cut down your cost by using the existing IDs that exist into the system and maybe work around the model.
All right, thank you very much, Rami. I don't know what you think at home, but you also have 40%. Star 714 star 13 hash is the code. We'll take a break. When we come back, the other contestants will be here. All right, so welcome back, and this is Ghana's Youth President. Thanks for still staying with us. That was round one that you saw. For every episode, would have round one, round two, round three, with 2 cabinets locking horns each time that you see. And now we are in round 2, or the part 2. And the 2 cabinets are from the Republic Cabinet. We have Blay Jerry Angsong. And of course, on my right, from the Osajifo Cabinet, we have Francisca Otu. Gentlemen and lady, are you ready? Are you ready? Are you sure? Anyway, judges and Right Honorable Speaker, in 3 minutes, Blay Jerry Angsong, it's your turn.
Right Honorable Speaker, eminent judges, fellow ministers, viewers at home, all protocol duly observed. My name is Jerry Blay Angsong, a level 300 nursing student of the University of Ghana, and I'm here as the health minister on the ticket of the Republic Cabinet. Mr. Speaker, the policy from the Health Ministry under the Republic Cabinet is good health and well-being, contributing to social and economic development of this nation. Mr. Speaker, our ministry under the Republic Cabinet has propelled momentum behind the drive for the universal health coverage, which is to provide all people with access to quality health care, and in providing these services do not cause financial hardship. Mr. Speaker, I'll start with the National Health Insurance Scheme. Through collaborations, continuous investment in sustainable health care solutions and capacity building, the Ministry of Health under this cabinet will also intend the renewal of the National Health Insurance Scheme through the renewal mobile system, and also increase the membership from 11 million to 18 million, which is representing about 58.93% of the population. Mr. Speaker, we will also allow our strategies to focus on health promotion and disease prevention through health education, that is sanitation improvement, control of malaria, HIV, tuberculosis, and nutritional education by a policy we are initiating by the Republic Cabinet called the CHEW, which is Community Health Extension Workers. Directorate of Public Health will be recreated into new structures and recruitment will be commenced. Mr. Speaker, health messages for behavioral change will be redesigned to communicate in a manner which will provide adequate time for the population, and the ministry will work closely with the key sectors, the local government, and partners to provide relevant information that will emphasize promotion and disease prevention so that Ghana can achieve the development goals number 3. Mr. Speaker, we'll move on to the provision or improvement of maternal health service in order to reduce maternal and child mortality. Mr. Speaker, traditional birth attendants will be trained to
All right,
serve
thank you
as a
very
link.
much. A round of applause, please, for. All right, so that to my right, representing Osajifo Cabinet, is Francisca Otu. If you're ready, in 3 minutes, your time starts now.
Mr. Speaker, honorable judges, fellow ministers, I am Otu Francisca, a level 300 procurement and supply chain management student. And then I am the health minister for the Osajifo Cabinet. My mandate as health minister for the Osajifo Cabinet is to improve the quality of healthcare services while lowering the cost of these services. As part of these, we'll modernize government hospitals, upgrading infrastructure and latest technologies as number one. 2, increasing the number of medical and paramedical colleges to make Ghana self-sufficient. 3, school health program will be made a major focus area, and health and hygiene will be made part of the school curriculum. 4, education and training. Of course, we'll look at the regulatory bodies of healthcare in Ghana and then put in routine checks to make sure that they are in good standing. Also, as health minister for the Osajifo Cabinet, I'm looking forward to reducing some leading medical concerns within the health sector in the country. With infant mortality rate, first of all, improving sanitation and then immunization against infectious diseases for children under 5. Family planning. I believe that age and then the length of interval between births affects the likelihood of babies dying during their first years. And these are more immediately amendable to change. Therefore, there will be education to the public on family planning measures. There is a project that is in the pilot stage, I call the FACO project, where most of these maternal mortality issues are from the northern part of Ghana. These people there don't have accessible means of transport to the nearest health facility.
All right, thank you very much, Francisca Otu. Of course, we will allow you to answer questions from the judges. We'll start off quickly with Mr. Blay Angsong of the Republic Cabinet. If you're ready, LC Apao, take it away.
Mr. Ashong.
Yes, ma'am.
Ansong, right?
Ansong.
Angsong. Okay, thank you for teaching me how to pronounce your name. Yes, I find this very interesting, showing that you are prepared for the contest, right?
Thank you.
But I want to find out from you, as a declaration law, how did you get the money to do this? Just briefly.
Actually, I'm the CEO of Lucius Office, which is a media company established by myself. So I do this.
So you
by
got some
myself.
support. To
Yes,
be
please.
honest with you, I've mentioned this when we're doing the screening, that I will want copies of manifestos even before the contest. It helps you as a judge to understand what you are asking and the questions you are asking about. We'll discuss that backstage and see how to make these accessible and available to judges. I personally don't find anything wrong when this is shared with the judges especially, but that's just by the way. In your manifesto, you are thinking about distributing mosquito nets as a preventive measure to malaria. I find this so archaic.
Please.
What's your idea about managing and reducing the state of sanitation, the poor sanitation we have in Ghana, and linking it to delivering health services for our nation? I'm looking at very creative and innovative ways of addressing public health issues in Ghana. So maybe your thoughts.
Okay, thank you, Ma'am. Please, the statement in my policy was to make campaign that will extend to the use of the distributed mosquito net, because I've realized that those nets which was distributed to us is still in our rooms. We are selling them outside. Sometimes you buy some outside and it's being branded not for sale, and these things is causing us a huge harm because we are having them but we are not using it. So we will educate them that the importance of them using it rather than them keeping it.
Master, if you give me something and I'm not using it, that means I don't have the use for it. We should be creative about solving and eradicating malaria from our community. Thank you.
All right, so we'll move
I have
quickly to
a brief
Mr.
question
Prince.
for him.
Yeah, very well.
At the beginning, you mentioned one of your aims was to lower financial hardship. How do you propose to do that? You did not say anything about how you would lower the financial hardship.
In lowering the financial hardship, our policy with the National Health Insurance Scheme renewal has come to stay with the mobile one, and the momentum behind it that the people should be taught that they should renew, and in renewing that we can get enough funds in the NHIS, and it's becoming very easy for them to renew since they can on their phone. So for that one, the renewal method will go very fast, and we get a lot of funds within the NHIS to support the sector.
Very well. A round of applause, please. And now, Francisca Otu from Osajifo Cabinet. If you're ready, let's take questions from the judges. Who's ready? I see Mr. Ivor Greenstreet looking through the papers. Over to you.
Yes, once again, at the beginning, you had two main aims: to improve quality and lower cost. You spoke about many things very eloquently and well about improving the quality, but like your colleague minister here, you never told us how you were going to lower the cost. Perhaps you can tell us some of those things you had intended to do.
Thank you for your question. First of all, looking at the National Health Insurance Scheme, most of these funds from the scheme are rather spent on the nursing trainee allowances. And then I intend to scrap that off and use those funds for the NHIS. So with that, I know that when I do this, I'm going to affect the nurses. They are going to complain. But what I intend to do is to bring in quasi loans where we can support them after school when they are posted to the various hospitals. They get the money and then pay back. And then also, you're going to make a collaborative effort to form an international alliance with other hospitals so that we don't have the capacity to give the quality healthcare as it stands now. So liaising with them, they can give us some form of support. Thank you.
Thank you. Well, I see Elsie Appa is a bit confused. Lawyer.
Francisca, I don't seem to understand your last point. Well, collaborating with international institutions to do what exactly?
Well, I feel that collaborating with them, with other international, forming an international alliance with other hospitals, they have the facilities we don't have. So if we need it, they can support us with anything we want, sort of. So it will contribute fairly to
Ghana at 60 what? Anyway. No, there's nothing wrong learning from the best practices of other states, but don't leave all your eggs to be washed and cooked with in other people's pots. When you are young people, we want solutions grown in Ghana. You get my point? Solutions grown in Ghana. Your people are dying. Life expectancy 56 years old for men, 58 for women. You are still thinking about how to go and get support from an external institution. Anyway,
that is why
my question to you: drones versus cheap compounds. I didn't hear you say anything about delivering community health services. You mentioned a lot of problems that are related to public health issues in Ghana. So what's your take on purchasing or investing in drones to deliver health care versus building infrastructure in communities to ensure that women and children receive or get access to medical care? What are your thoughts?
Well, I feel that the drones will not be of so much help as compared to building or providing more hospitals. So one thing we are going to do is to build more hospitals so that these nurses, after their education, they can be employed and then deliver health services in the country.
All right. Is there anything, Mr. Jignesh Viradia?
Yes, when you are saying modernization of the hospitals, can you give me some statistics on how many hospitals do exist in the country and how many you want to put in more? Just to update you, there are 140 government hospitals. How much more do you want to add?
Well, most importantly, I'm focusing on modernizing the existing ones. We have to make them better. They should be in better standing before we move on to add other ones.
What I was expecting from Honorable Lady Health Minister was to focus on malnutrition, which Ghana needs the most, which I think should be an agenda to your manifesto. Thank you.
Now, if you think we've ended, no, we've not. The last round is about to begin, but it will only be after this break. Don't go anywhere. We'll be right back. Nana Ama Aiden Sam. Round of applause for her, please. Well, you are here alone and you have 3 minutes. Of course, that's not going to be added to yours. Judges, if you're ready, your time starts now.
Mr. Speaker, Right Honorable Judges, Ghana has seen several problems in its health sector, despite the greatest strides taken by our leaders. And that is why Gold Coast Cabinet has come up with GCK, Gold Coast Care, consisting of effective policy directions to ensure that all citizens get access to quality health care. These policy directions will be under what we call the FAQ headline: F for financial risk protection, A for access, and Q for quality health care. And they are in line with the SDG Goal 3 to promote good health and well-being. For financial risk protection, Mr. Speaker, my ministry will establish regular audits through the National Health Insurance Authority to seal the financial leakages present currently. Also, claims of health care providers on the insurance scheme will be investigated to avoid unnecessary cost pressures due to duplication. Current percentage of the annual budget spent on compensation is 59%. That is compensation of health workers. And just 26% is spent on goods and services, leaving 15% for capital expenditure. In order to provide more healthcare facilities in rural areas, the amount spent on compensation in the annual budget can be cut down by about 5%, such that these monies can be used to create more community health-based planning services compounds in the rural and remote areas in order to promote healthcare facilities there and make it more available. Moreover, to increase the number of health workers to WHO standard, which is 1:1,000, than Ghana's current ratio, which is 1:10,000. My ministry will place legal instruments in the form of bonding so that health workers, when they finish school, will be required to serve the country for a considerable number of years, about 10 to 15 years, before they can leave the country to curb the brain drain problem and retain our valued medical health professionals. Also, we would institute the Village Doctor and Village Nurse Award, where health professionals who make outstanding differences in the rural areas will be rewarded bountifully to encourage others to work in such areas. Furthermore, to reduce disease mortality and morbidity in every aspect, our main policy direction will be to collaborate with quasi-government organizations and non-governmental organizations to create public health awareness and logistics and provide logistics in already existing healthcare facilities in the rural areas. Thank you very much.
Thank you very much. You can't but just keep smiling while she presents. But of course, your job is to listen and vote. The judges will score and
Mama,
assess.
you made my day.
Wow, it's
Thank you very
amazing.
much.
Anyway, so thanks for making her day. Maybe take it away from there.
Thank you very much. You said the FAQ what?
Headline.
Headline.
Yes,
Okay.
please.
No, that's for me quite creative. But bonding, you mentioned something about bonding medical workers to provide some services to the nation before traveling.
Yes,
I
please.
don't think at the moment the issue is about them traveling. It's about the system being able to absorb them.
Yes, please.
Because we have a lot of nurses sitting at home that are not even yet deployed to any medical facility. So I'm wondering what the bonding is going to do.
Okay, thank you very much for the question. Currently in Ghana, when some doctors complete medical school, they leave the country to other countries in search of greener pastures. So what my ministry is going to do to take care of that will be to come out with, let's say, a contract that they sign before they go to
No,
medical.
that part is well understood.
Yes,
My
please.
point is, what about the doctors who are home for about a year or two that are yet to be assigned hospitals and
They-
nurses that are sitting at home waiting to be deployed?
Thank you
I
very
think you
much.
need to deal with them first before you bond the rest.
Okay.
Right?
Okay. So for that, what we'll do is, in some remote areas, there's a lack of doctors and lack of nurses, because currently Ghana still needs 36,000 more nurses to meet WHO requirements. So what my cabinet will do will be to post more nurses to the remote areas and train them to sag their minds before they move to these areas, so that they'll be prepared and ready to work and to face challenges that they come up with over there. Thank you very much.
All right, thank you very much there, Nanama. All right, let's do Mr. Jignesh Viradia.
In terms of the nurses, you said 36,000 more nurses are required in terms to satisfy the gap. So how many nurses do we have as of now?
I think we have.
78,000.
Okay, thank you very much.
Well, that's a judge that puts it to you as it is. Let's do Mr. Ivor Greenstreet now.
Another round of applause. Did very well.
All right, thank you very much. If you think and agree with the judges as well, then of course, take your phone now, dial *714 *13# and vote for Nanama Aidan Sam from the Gold Coast Cabinet. While voting for the candidate, please don't forget to vote for the candidate as well. And I will take a break here. When we come back, I'll line the 5 app and we'll see what the judges scored on their score metrics. Don't go anywhere. We'll be right back. Well, welcome back, and this is Ghana's Youth President. I enjoyed it. It was keenly contested by these 5 great minds. All right, so that's how you have it for all of them. Remember, it was Yasantiwa, Chamberlain Salali, Adzigbe, Democrats, Isaac Boateng Jamina, Republic Cabinet, of course, Blade Jerry Anson represented. Osajifo Cabinet, Francis Kautu. Last but not least, Gold Coast Cabinet, represented by Nanama Aidan. Remember, all you have to do is to pick up your phone, dial *714*13# and vote for your very favorite minister, but of course cabinets as well, so that you could help them win the cash prize 20,000, and of course the president also 11,000, and the best performing minister as well with consolation prizes. Let me pick the thoughts. I've seen lawyer Elsie Apau speak about her thoughts, and so I'll just speak Mr. Greenstreet's thoughts about the whole episode today. What do you think on the whole?
Well, I think on the whole, very impressive performances.
All right.
Good research. They have to improve on their timing for the amounts of points they want to make within the 3 minutes. So that requires you to do preparation.
Okay.
You have to look at your work, and before you come here, you should have in your room or with others spoken out all the things you want to say, and have timed how long it takes you to make the important points.
Right.
And also, some of them were a bit too nervous. They need to relax, take their time, not speak too quickly. But all in all, I think I was very impressed. I wish them all the best, and we're looking forward to the contestants in future episodes.
Absolutely. Mr. Viradia, you enjoyed the episode, didn't you?
Yes, it is quite exciting. The 3 points to consider, or rather suggest to all the participants, is confidence, confidence, and confidence, which I think all of you should boost and shoot it up.
Boost and shoot it up. That's what Mr. Viradia has to say. And so, if you want Mr. Chamberlain Salali Adigbe of the Asantua Cabinet to win a lot of votes, just take your phone as well. Also, Democrats Isaac Boateng Dramina, of course, Republic Cabinet, Blay Jerry Ansong, Osajifo Cabinet, Francis Kautu, Gold Coast Cabinet, Nana Amma Aidan Sam. Vote *714*13# is the code. Follow the prompts and then do just that. Of course, I want to say a very big thank you to Mr. Jignesh Viradia for coming, and also lawyer Elsie Apau, last but not least, Mr. Ivor Kobina Greenstreet. Thank you very much, Right Honorable Speaker, as well. To you at home, our audience, a round of applause for yourselves as well. And to you at home, we'll see you next week. God bless you and stay truly blessed.